Okay, I'm back. Good evening. My name is Dr.Noury Adel. I'm an oral and maxillofacial surgery specialist, and I'm also working as an assistant lecturer in the Department of Oral and Maxillofacial Surgery at MUST University for Science and Technology. And I'm also the owner and founder of Cosmetico For Facial and Dental Beauty. Very special guest. Hello, Dr. Aya, ازيك? I have a very special guest, Dr. Gideon Kwok. He's one of the founders and medical director for Skin Perfect Medical in South California. He has been a speaker and trainer for Cutera and Bioform, which is known as Radiesse. He is also currently on the advisory board and national speaker and trainer for Galderma. And he's also a trainer for Mint PDO, which we are gonna speak about today. And his clinic accolades of Galderma portfolio. It's like his clinic is always using the portfolio of Galderma. Dr. Gideon is running also the aesthetic immersion, and he's doing an excellent work. And I guess we are very pretty lucky today so that we can have him. I'm just waiting him for مستني بس يدخل على اساس ندخله في اللايف. Okay. Okay, I'm still waiting. ازيك يا دكتورة آية؟
Hi, finally.
Hello, how are you?
You know, my heart was sinking. I was like, oh my God, we're gonna like lose this life. You know?
I know, I'm like, technology doesn't like me. Really does not like me.
Dr. Gideon, can you see me well, or I'm like hot crop?
I think you're twisted to the side, it seems. You're like,
okay, let me.
Yeah, there we go.
Is this better?
That's better.
And the facial threads.
Yes.
So if you can at first, what are the different type of threads and what are facial threads?
You know, so I think with Instagram and everything on social media, a lot of people kind of mistaken and grouped together all the different threads. And so I decided when I started teaching to differentiate between, I guess you could call lifting foundation threads and the ones that you see where everyone's just sticking all these threads in there and they pull them all at one time. It looks super fun and pretty, but I think those aren't going to give you the lifting. Those are what I call the volumizing or the superficial kind of placement of threads to improve quality of skin. So a lot of the ones that I've been doing more or teaching a lot are more of the foundation ones. These are going to be your thicker ones. These are the ones that have the barbs on them. They have the little, you could say almost like little fish hooks on them. And they're the ones that are actually going to do the lifting. They're the ones that are going to be placed deeper. So they're going to be placed in the subcutaneous tissue to hook into that dense connective tissue. So you lift that tissue back up to where you want it to be, or you augment the tissue to pull it up into a different position, which I know trends here right now are doing the cat eyes. I think that is a huge one. You can call it cat eyes. Other people call it foxy eyes. It's also known as the Bella Hadid's or the Cleopatra eyes. A lot of different names for it and different, I guess you could say different amounts of pulling you can do. So you can pull it from more lifting to the brow for people who are not ready for like maybe a brow lifting, to all the way out to the lateral brow, to even pulling out the lateral canthal area all the way up if they want that more exotic look. So that's where the artistry comes in and how you want to play in patient expectations. So it's a trend.
Since you said about the different types, that are types that promote collagen and enhance the propagation process, and other types that are used for lifting. But what are the materials that they are made of? Whether PDO,
So in the marketplace, if you're looking at the market in general, and so I've been following threads probably for the last 12 years. because I have a huge Asian population in the Southern California area. They're the ones that fly back and forth from Taiwan, China, to live in the US part of the time for their kids, and then they go back. And so I've been hearing about threads for probably about 10, 12 years now. And just understanding the Asian marketplace, the Asians are really into trends. They're very, very fast-paced trend. And if you wait a couple of months and really on that bandwagon, really, because it's some.
Okay, added.
I think it's just sweating already.
Finally,
Yeah. So I made a little introduction again, but I guess we stopped at that there are different types of thread. We were speaking about the BDO, PCL, and PLLA. Okay,
Yes.
we can take it from here.
Okay, so I mean, so with my Asians, you definitely get a lot of them have actually had all three. So if you're really looking on the world scheme, there probably will be more different types of threads coming out soon from what I hear from the Koreans. But currently on the marketplace, and this is the whole world marketplace, the US marketplace, we actually only have the PDO threads and the PLLA threads. So if you go PDO, the polydioxanine, is the only one really kind of well, it's there's PLLA here in the US that's cleared but not used as much, but the PDO is the most common one here done in the US. I think it has the most tensile strength and the most lifting capacity that you're going to get out of it. Stimulation of collagen is pretty decent as well. The next one that we do have approved here is your PLLA. We have the InstaLifts here. There are some Korean companies that are slowly bringing the actual PLLA threads here. Typically, those are going to be more for volume, so those are going to be much more superficial because, like Sculptra, they're going to stimulate a lot more collagen because it's the polylactic acid in a thread form. Not going to give you very much lifting capacity because the material itself doesn't have the tensile strength to actually hold, which is why when you use InstaLift, you don't really see, in my eyes, you don't really see the dramatic lifting that people want, this lifting of the jowl to really go away. You got to use something that's a lot more tensile strength and has more lifting capacity. PCL, which is an actual filler that's approved in the EU market, they have, I think it's Elance, that's actually the injectable form of PCL, so polycarbonolactone. We don't have that here in the US because in and of itself, the material is not approved as an injectable form. So it may be a little bit while before we get it, but some of the Korean companies are sneaking it here in the US. But from what I know and what I've done some research on, the actual thread themselves do not have the big capabilities of doing as much lifting as a PDL. So if you're looking at tensile lifting power of it, the most is gonna be from your PDO currently still, then your PCL, then your PLLA. If you're talking about longevity of the product lasting in the skin and doing its collagen stimulation, then PDO has the least amount, then PLLA, and then PCL. Because PCL actually, longevity-wise, they say can last upwards into the 2 to 3 years range. So that's kind of the.
What makes men's BDO that much special?
You know what? When I first got into this, I played with a lot of different threads to really find what I'm comfortable with. And I would suggest people out there that do watch this is make sure that you understand the characteristic of your thread. So when we're talking about the lifting threads, the true lifting threads, whether it's for here or the face or the neck area, or make sure that you are looking at how they make the thread. So there are threads that are cut, and that means they make the thread itself like a single thread, and then it goes through a process where they actually cut into the thread. And so the barbs or the little things that hook onto the tissue end up becoming like a leaflet. It's just kind of like peeled skin off. And so what that does is it decreases the integrity of the actual thread, because now you've cut into the thread into a little nick. And so the thread diameter now becomes smaller in those areas where it's cut into the thread. And so the lasting ability of those are the ones where you typically hear, oh, I did it, and a month or 2 months later, I really didn't see as much of the lifting effect. Those typically are going to be your cut threads. So new evolution is now using what we call molded threads. So when they're making it in the process, they actually place the material in there, and they actually mold the actual thread, which even the barbs, the things that stick off of the thread, they hold into it. And so that's why the molded threads are what a lot of us who want that tensile strength and lifting capacity are looking for. And so my evolution is, if you're starting off, cut threads are actually easier to manipulate. If you pull, you're placing in the wrong area, you can undulate the skin, create more dimpling and stuff like that, and you can unhook the cut threads because they don't have as much lifting capacity, and the little barb themselves don't have as much strength to hold on. So you literally could kind of unhinge it if you make a mistake. So I definitely started with those, and it's like, in the beginning, it's like, okay, those are good. But then as you start doing them, the longevity for your patients never really lasts, and then they start complaining about the longevity because you really do want it to last them somewhere upwards into that 9 months to a year range. I give my patients an honest opinion. I tell you, every year you age, every year we're going to need to adjust your face somehow, some way, because you're globally aging. It's not just one area. So probably once a year coming in and doing some threads, just it may not be in the same vector. It may be a different vector design based off of what you're losing as far as aging and the gravity. The molded threads are going to give you a lot more hold, a lot more longevity, give you a lot more tensile strength. Nowadays, I actually even tie off my threads. I'll put two or three out of a port side, and I'll tie them together, and that creates a stronger anchor point so that you get less mobility of the threads. The reason why I do like the mints is the hold of the threads are really, really strong. The secondary effect of it is actually when you look at the thread, they actually place the barbs all in a 360 helical design. So it's placed so it grabs onto tissue north, south, east, west when it's placed in there, versus some threads
It's like
only
3D
placed.
dynamically designed to give us superior lifting capacity.
Exactly, because you want to lift the tissue not just in one single plane, you want to lift it in a 3D plane. So that's why the mints, to me, have done a really, really nice job, having played with a bunch of different threads. The mint ones really, to me, are much more versatile. I seem to be able to use them everywhere. They are a manufacturer, so one thing people definitely need to understand is threads do start to break down. So if you're getting a person, a company that is more of a middleman, they go to Korea, they go to Europe, they buy the threads, then they take it and then in their warehouses repackage it. They open up the package, they repackage it and put it into their own threads, the packaging. Then the threads themselves, once they start to open up beyond that silver packet that they come, they start to degrade. And once they degrade, they actually start to lose their tensile strength and integrity. And so you'll see people place threads in there, and then while they're pulling on it, it ends up snapping on them. And so that tells you that that is not really a manufacturer typically. That typically is a middleman. And so when you get into the middleman of threads, now you're not getting threads that are going to give you the best results because they've already started the oxidation process, and it decreases the longevity of your thread. So Mint itself is a huge company in Korea. They don't just make threads, they make tissue stuff. They actually do breast implants. So they're a big company with a lot of R&D behind them, and they produce their own threads, and they come directly from the manufacturer. So that's the second thing that I really, third thing of why I like the Mint is because it comes from the manufacturer themselves. So
You're doing a great job with the Mint PDO and the emphatic immersion, and we will come to this point later on our webinar. I want to speak about the silhouette soap as you get to try to use the post. What is your opinion about it?
So the Silhouette Soft or the InstaLift here, I mean, they're PLLA thread. They're PLLA. I didn't do too much research with regards to it, but when I started looking into it, the interesting thing is that if you look at it, it looks like two knitting needles. There are two needles on one end. You start from the middle point, you go one point, you go the other point, you exit. The fact of the matter is that the thread itself, to me, does not confer lifting capacity to the actual thread itself. The PLLA is just the cones themselves, and so what is the goal of that aspect of it? If you're just putting PLLA in the cones, literally you're just stimulating collagen at where the cones are. I don't know exactly the actual thread material. If they are PLLA, then that tells me that that thread itself is not going to give you much pull. It's not going to give you the lifting capacity that you're looking for out of a thread. So it's more of a mild collagen stimulator, or not mild, a moderate collagen stimulator placed in certain vectors, and as it grows collagen in that vector, maybe you can get some hold into that. So remember, all of these threads are typically approved here in the US for tissue approximation. So they're not for lifting, they're not for anything except for how they all get it approved or cleared here is for tissue approximation. So that's all they need to show the FDA. So they're not out there selling it, or they can't really, by FDA standards in the US, sell it for lifting capacity. You can only somewhat infer it here in the US. So our technical aspect in the FDA and how that is, it's a very roundabout way when they get the clearances for the thread. So in my opinion, the InstaLift does not do a strong enough lifting factor. The second thing is that InstaLift here in the US is very expensive for each thread. I think they run upwards in the $100 range per thread. And if you're putting like 3 threads in here, which I don't think is going to give you the right vectoring, the right lifting, it's very expensive. Yeah, so for me, a PDO thread, even with a mint PDO, you're looking at $40 a thread. So you can put like 4 into this direction, maybe put another 2 here. You're still under $500 if you're putting 10 threads, 5 on each side. You're still under, $500, $600 our cost for your thread. So to me, PDO threads gives me much more versatility and much more probably longevity and better results with regards to that.
So, Doctor, speaking about the fox and cat the topic of our webinar today, how can we use the technique for placing the thread? Is there a difference between the fox and cat eye, or they are like the same thing with a different nomenclature?
I think it's just different nomenclature. I think it's all about the marketing that's out there. You could call it, you honestly could just call it a brow lifting. You could call it cat eye just based off of how you want to pull it. Foxy eye, Cleopatra eye, Bella Hadid eye. So if you're looking at it, when I'm talking with my patient, I literally kind of pull up on their eyebrow and really talk to them. Is this the look you're looking for? Is this the look you're looking for? Is this the look you're looking for? And so it's really a conversation and setting the expectations with your patients on what they are looking for as far as the results. My older patients tend to want a little bit of lateral lifting, but most of them want a little bit more, just this whole middle lateral portion of the brow slightly lifted up. So you could use threads that actually fixate and do a little lifting in the midline, and then ones that really do a lot more potential lifting through the whole lateral portion of the face. And so that really kind of dictates where you would do it. But typically laterally, if you're doing more of that Cleopatra, a little bit more exotic eye where they really want that lift of the lateral canthal, you're going to probably see what angle and what vector pulls up on that lateral canthal area to give them that look that they're wanting. If it's like this versus if they just want the brow lifted, the lateral brow, and to lift the lateral brow up, you can definitely do that. So typically I'm starting right at the brow, underneath the brow line, in kind of that C vector based off of what vectoring you really want. And it's typically 1 to 2 threads in the vector that kind of holds it in place. What I've learned is over the last year when doing it is that you want to probably tell the patient that you're going to pull it a little bit more dramatic, because in about a week, once they start moving the area, it will settle down. And so they're not going to be as
And they're
dramatic.
one of the process of lifting and fixing.
Yes, exactly. And so there are threads, and the newer threads from Mint, they do have new ones that are more what we call lifting, and that comes to the way you make the threads. If you're looking actually at the barbs on the threads, it's interesting when you look at the barbs. The barbs and the directions of the barbs actually are very, very important. It's kind of like when you're choosing fillers, the different rheologies of G prime and flexibility and how much HA acids are in there. The actual barbs themselves do make a difference. There are most of the lifting barbs are typically a bidirectional one. So the end point is one direction, and then the outer point is another direction. So you get that lifting portion from the bottom, and then the top portion that the anchors are flipped the other way. They literally anchor it into the tissue so that you don't get mobility of the thread. It kind of lifts and anchors it. The ones that are more fixation, you'll see that the barbs are right. They lift on one end, and then they flip right away into anchoring, and then they flip back to lifting and anchoring. So you're literally, in those cases when you're using those type of characteristics of barbs where it's literally a lift and anchor instead of a lift here and an anchor further back. In those cases, you're more about fixation, because when you lift and you flip it and you anchor it right there, then you lift and you anchor it, you're not actually getting any more lifting. You're literally just holding the tissue in place. So there is an importance when you are starting to look at your threads, just the thread and the way they are made. It's actually very important. And so, and this is starting to get into really a lot more into threads and the design of threads and how they play. But as I've been playing with all these newer threads and stuff like that, the design and the way they make the threads really do matter when you're choosing your vector design and what you want to do. So if you're like lifting a brow, you could lift it first, and then you would take other threads to actually fixate it and fix the tissue even more so you actually get that structural hold, because now you have threads that are holding in place too. So different concepts on how to use the different types of threads that are out there on the marketplace. You really do have to do research into understanding the differences between the threads that you're using and how the barbs are placed along themselves.
Dr. Gideon, I guess we can also try to treat a little bit of food if a male have like alluding in his upper eyelid. How much is it tricky to do a thread for a male without altering the eyebrow shape and feminizing it? Eyebrow shape.
So I mean, I did like on my last Mint webinar that I did for them. We actually had a male and a female, and so the males typically.
I attended this webinar, but before I attended a couple of other webinars too.
Yeah, we always put in more webinars together. So, you know, when you're looking at your males, the males typically what we want is we want a little bit more of a flatter brow. Your typical female ones, they want a little bit more arched or even like really pulled out laterally is what they're looking for. So in that case, for males, you probably focus a little bit more midline to lift them up in the middle and then lift kind of the whole thing up so that it looks a little bit more I guess you could say a little bit more on the flatter angle side, where there's not as much of a curvature to it. So there's ways of playing with your threads that you don't need to pull maybe as strongly in certain areas. Certain areas I will pull much stronger and try and lift the tissue up more to get more of an arch, more of a lift in that area. So it really just comes to your artistry when it comes to shaping the brow. But males, for sure, when you're doing them, make sure you keep them a little bit more flatter, versus females, you can arch them a little bit more or even give them a little bit more flat, but really kind of give them that really sharp angle type of a look. I think that dictates the artistry of male versus female in that sense when you're talking about your cat eyes. Make sure if you are injecting a little bit more into the frontalis muscle into this area that you do put toxin into the area, because if you don't, then your muscles potentially, because this is a thin area and your thread may be very close to muscle, that you may migrate your thread if you don't put toxin in there. So if I know I'm hitting anything in this brow area for lifting with the threads, I will force my patient to have to do toxin into that area. If you want to do it for cat eye, then I would definitely release a little bit of the orbicularis muscle that pulls down into this area, release that with a little toxin, so this laterally does pull out a little bit better, so you don't have muscle recruitment constantly pulling down. Because when you have recruitment pulling down, you're going to unhinge some of that thread and you're not going to get as dramatic of a look. So I would always recommend a little bit of mixture with toxins into the area.
Speaking about neurotoxins and fillers, do you think that we can combine the use of neurotoxin and fillers along with thread lift and the eyebrow? And if you are going to do so, which one will you begin with?
I would always do toxin should always be done, and if you can do it at least 2 weeks ahead of time so it kicks in, get the toxin done first. Fillers are definitely recommended if they are hollow in this lateral temporal area, kind of more into this lateral forehead area. I do fillers if they are hollow into this area, just because you want to create support onto the area before you wrap and lift tissue up over the area. I kind of talk about it a little bit. If you think about threads and the evolution into the non-surgical route in comparison to like a surgical route, threads are essentially along the same pathway, a different, severity of doing a facelift. So it's all about tissue pulling and lifting, which a facelift, they cut your tissue and they pull the tissue and approximate the tissue back up. So you're lifting and just working on tissue lifting. Versus volumization is when nowadays when we do facelifts, we're actually adding a little bit of volume with fat transfers and things like that. So both are needed to create better artistry and a better look. Because if you pull someone and they're super hollow in here, you may create more accentuated hollowness because you're pulling this into a hollow area. So if I were to do it, I would always recommend patients to do it prior to doing thread lifting, or if they're ready to get it done, you could do it on the same day. So I will do it on the same day. That's not a problem. If I do it on the same day, I typically will do a little bit more filling, especially in areas that are structurally not sound. I will build that structure and that foundation first before I do the threads. However, like a cheek, for example, because I know some of this fat pad has dropped down, I will actually do the thread first because I know I can pull this potential fatty tissue that has descended, the superficial fat pad that descended, I will pull that back up first and then see what hollowness you reach. Yeah, for sure. You could, how I kind of differentiate when I talk to my patients on whether or not they will need fillers is if I lay them down flat, you lay them down completely flat, you give them a mirror. If they like that result, then that essentially is the best result a thread lift can do for them. If they want more than that, then they're probably on the path and expectation of a facelift. And I would tell them and the patient, you need to probably consider a facelift because what your expectations are beyond what a thread lift will be. At the same time, while they're laying down, any indentations where you do see that they are missing some supportive deep fat volume, I will tell them you will potentially probably need some filler in these places to create that structural component. Because even with the threads, even though you see yourself laying back, you can see you're still hollow in this the piriform fossa area. You're hollow in this mid-cheek area. So those are areas that still will need to add volume for you. And so that's where, in those cases, more for those, I will do the thread lift first, and then I'll add the volume. But up in this temple area for cat eyes, I typically like to do structural volume so that they have a nicer fullness into this area. It doesn't need to be round, but it needs to have a slight fullness in this area before I pull over that fullness. Otherwise, I feel as though it accentuates the hollowness into the area. I missed that question. Can you ask that again?
Yeah, I was asking what are the possible complications that may happen from doing a fox or a cat eye regularly, and how can you manage those complications? I mean, when it comes to filler, you can easily dissolve the filler, right? When it comes to thread, it's like
Yeah.
you are placing a thread on the end of the
I mean, honestly, I think fillers are still more dangerous than your threads. Because remember, the vascularity into this area, there's actually a couple of incidences of blindness from this area because your superficial temporal artery does give off branches that connect into the supratrochlears and stuff like that. So fillers are still much more dangerous. Threads really, honestly, really don't have too many issues. The biggest one is you just don't get the longevity or the lasting ability of the lifting aspect of it. Remember, when a thread is placed, if you don't get the lifting capacity from it, then all it is a really expensive smooth thread. So that smooth thread is like the ones we superficially put. It's going to stimulate collagen. So if you don't see it, you don't feel it, it's just going to stimulate collagen into the area. So it's still beneficial in the long run to the patient. It's just a very expensive smooth thread for them. Really, the only big things that I've really seen are typically a little bit more potential bruising. If you literally jam the cannula up very quickly, you can get some bruising that will last them for a little bit of time. I have heard of patients who have had migration from other practitioners where the thread migrated back down, and that will be avoided if you do your toxins or if you're using a thread, to me, like a mint, where the barbs are really more robust and will really clip onto the tissue and not mobilize very, very much. So I think the thread choice in that case helps with that. If it does migrate, then you just need to, unfortunately, you can take a little incision and try and dig out that thread and pull it out, which should be pretty non-significant in that aspect of it. Other than that, sometimes a little bit more sensitivity up here. The scalp is much more thinner and sensitive. So you'll find patients that like washing their hair and touching it, and it's a lot more sensitive. So I tell patients it's going to be much more sensitive for maybe about 2 to 4 weeks instead of the 2 weeks on the face. It may be definitely much more sensitive getting into the scalp area. But other than that, I have not really run into really any true contraindications or any true bad adverse events into doing the cat eye area. It would probably be more along the lines of people complaining that it doesn't last as long. And so sometimes nowadays I've switched my talk when I do it. I'll tell my patients, we're going to do this first time. If you don't want to walk out looking too overly dramatic, then when it does settle down, probably in 2 to 3 months, we'll come back in and maybe put what I call a touch-up or additional couple of threads into that area to give you that full lifting power that you really want. So I think if you're setting the expectation correctly, your patients will be very happy with their results. I just tell my patients, you either live with dramatic eyes for a week or 2 weeks, or we're going to come back in a couple of months and add more threads at that point in time. So either way works perfectly fine, as long as you set expectations.
But I really want to know what's your personal opinion now we had the that are starting to have the fox eye and cat eye. What is your own opinion about the growing trend? Are our customers starting to lose the visual perception of the normal appearance, or we encourage all people to do those things, or they should be done only by if necessary and if it fits your own patient face? Because I guess we know that there are a lot of teachers out there who are doing those things and are just doing it for granted.
Yeah, it's a hard. I mean, this is our field of medicine, and it's a hard thing because you want to give patients what they're looking for. I think it's the correct expectation to talk to them. This is going to give you a much more dramatic look than what may look natural. And I think you, as a practitioner, ethically need to make that decision on what you're comfortable giving to your patients. Like I do that with fillers in the lips. I mean, I live in LA, and so, you want these girls that want these big, big, big lips, and it's kind of like you can get them there, but they're gonna look, and so you have to remember that it's still your it's still your calling card of when a patient walks out and says, "Oh yeah, Dr. Kwok did my lips," and somebody goes, "Holy shit, that doesn't look so good." So you definitely have to be a little careful of that and really have a comfortability of what your I guess your whole artistry that you want to put out there on the world really looks like. So I'm more careful. I will do it. My younger girls, when they come in, it is all about drama. They want the dramatic eyes. They're looking for that. My older patients are sometimes they're looking for that, but most of the times they're just seeing this lateral sagginess into this lateral portion of the eye, and they're not ready to do a blepharoplasty. They're
So
not.
mostly the millennial patients are the ones who are seeking those treatments.
Yeah. So you can do. I mean, the thing is, the cat eye, the foxy eye, it's more trendy for the younger generation. So I try not to tell my older patients that I'm doing a foxy eye or a cat eye. I'm doing more of a brow lift to lift up this brow that is starting to drag down because they're losing volume. Remember, when you're born, your bone structure into this area is a lot more projected out. And as we do age, we lose that bone support. And so that, in a sense, is why you get this laxity in the tissue. Yes, you can correct it and fill with filler up to a certain point, but you're not going to overly fill it to try and compensate for the loose skin. You were born with this skin that was made for the amount of fat and bone structure that was already there. You've now just aged. And I tell patients by the age of 30, some of the research that's out there is showing that you're losing between 3 to 5 cc's or syringes of volume in your whole face from bone structure loss, deep fat loss, superficial fat loss, and just skin aging. If you're losing 3 to 5 on a yearly basis by the age of 30, imagine a patient comes to you at 40 years old, 50 years old. I mean, my face actually has 40-something syringes of filler on top of thread lifting. So you can make it look natural if it's done well, and this is the hard part in our industry. It's talking about what looks natural and how to get people a natural look. You can do natural and still do a lot for patients. It just comes down to them, unfortunately, trusting your results, your artistry, and not following trends so significantly unless it's something that you're comfortable doing and something that your patient is comfortable with. I think you really do have to talk about that because, there's that big trend in the U.S. about Brazilian butt lifts and getting these huge, huge butts. Right now it's huge, but you have to think of it 10, 20 years down the line when they start to age and they lose this fat and their butts start to sag. What's going to happen? You've overly stretched the skin out to accommodate for all this fat. Now that fat's starting to disappear. Now that volume and the skin sagging. Are we going to be doing a lot of cutting to the skin to deal with that looseness because we've stretched the skin out so far out there and now they're losing all of it? So I
like
always
you are distorting the whole body with your aesthetic intervention.
Exactly. So I
Doctor,
do keep
what
that
are
in
the
mind.
patients when you say to her, "No, I can't do a Fox cycle"?
You know what? I think everybody could potentially use it if it's a different version of it. So fox eye is just a nomenclature. It's just a marketing thing to get people to go, "Oh, what's that?" It's something to kind of make people click and say, "Hey, I've never heard of that. That sounds really cool. That sounds interesting. What is it about?" Then you can start to educate them on what it is that you're looking at, whether you're looking at really just more lifting the brow up versus really lifting the lateral canthal up and giving them that more exotic look. So I think you can't classify cat eye, foxy eye into one specific look. I think you have to classify it in general. It's a lateral brow type of a lifting treatment from a generic standpoint, if that makes sense.
Okay. Doctor, we reached the end of our webinar, but I can't end it without asking you about the amazing work that you are doing in the aesthetic immersion. I have attended a couple of webinars about the MUST video. You are doing a great work. I actually have posts. I made a post a couple of weeks ago about the aesthetic immersion. I attended a webinar and I saw that you were doing a live show on Facebook. And I
Uh-huh.
don't see this a lot. I don't know about your country, but here in Egypt, it's very rare to find a free webinar with a live session on the case. It was like
Yeah.
highly educational.
Good.
I want to know, how did you start doing these type of immersions? How did you start doing this sort of work? How did you come up with the idea? And what are the future things that you're looking to do with it?
So ultimately, you met my partner Lori at one of your other Facebook things, and so Lori and I got together probably 2007, 8 is when I hired her on as a nurse practitioner. She was brand new in the field. I've always done back when, I mean, I started back in 2004 when I was a second year resident. And so I've been doing this for the most part of all my medical career. And so initially, I've always done the training for my own staff on how to do injections, how to do fillers, how to do lasers. All of that has been all my personal training. And I didn't actually start training for any of these companies until they started pushing me. They're like, you're a good trainer, you teach your own staff, they seem to all come out doing such amazing work. Like, you need to come out and train for us. And so I started doing a little bit of that early on in my career. And then I started working on my business more and building the practice more. And so Lori at that time had excelled really, really well. So I told Lori, you go and start training for the companies. You can be a little face of the company. And so she started doing it, and then after a couple years, she ended up leaving us to try to do something on her own, was successful, and then about 2-3 years ago, we got back together and talked about it, and by that time, she'd been on the circuit trying to do lots of trainings around the country with conferences. I kind of did a little bit of training for Galderma just within my LA area. But was super busy. I actually found out that those 2-3 years that I was training for them, I became actually one of their top trainers, top requested trainers, just from being in this area. I didn't have to travel nationally. So that was already like, okay, I'm doing something well that all these salespeople keep asking me to train their accounts. And so when Lori and I got back together, we both, having trained for companies, you have to realize in the US, when we get approvals for different fillers, like a Restylane, it literally is nasolabial fold, and it's literally mid-dermis that we can teach the filler. We can't teach piriform fossa. We can't teach anything else except that. We can only use the needle that it comes in the box. So it's a very restrictive teaching ability that we can do for the companies here in the US. So we would always go to these trainings, and these people were asking, okay, how can I inject the under eyes? How can I inject the temples? What about the chin? And here in the US, because we don't get full face indications, I can't train on any of that with the companies. So that's where a lot of these people would start reaching
You don't have the
out.
option to do any advanced techniques.
You can't do advanced, which to me boggles my mind, because you're getting all these people wanting to do these things, yet you can't train them properly on how to do it. So Lori and I sat down and were like, we really want to make sure that the industry elevates itself and people are doing proper things. And because you have to realize, when a patient first comes in, if they have a bad experience with a practitioner, they don't necessarily just blame the practitioner, they blame the whole field. Like, it's not meant for me. I have bad outcomes. It doesn't work well on me. And it's not that. It's just the practitioner who injected you was bad at what they were doing, unfortunately. Sometimes they're newbies and they're still learning, and they need to gain their experience, but a lot of times it's just under eye specifically. They just stuff. They don't know what they're doing. They think it looks fine, and it looks fine when they go away, but not understanding the product, how it's going to settle. It ends up looking puffy. It ends up swollen. And so this is where Lori and I's goals is to make sure that we train practitioners well enough that they can come out and teach other people properly, work on patients properly, so that we elevate the whole industry. Because when you elevate the industry, more patients are more willing to get these things done. When I tell my patients I have 40 syringes in my face, they look at me and go, what? You have 40? And this is only in the last 3 years that I have 40 syringes. So it's I do 10 at a time, 10 at a time, and nobody really notices. So you can inject really well, inject properly if you understand how the face ages, where you artistically need to add volume. And so this is the goal of our aesthetic immersion, to start teaching basic foundations, helping people understand anatomy. Where are you losing volume? How do you replace that? Where does this go? What type of filler are you going to use, and why you're choosing your fillers? A lot of people here in the US, because we have 3 major brands, they just choose one brand and bring one brand in. They use it and they go, well, they told me like Voluma, you use it, and then you ask them, well, what is the characteristic that makes you choose it? They go, well, it looks puffy and it lifts over here. They really don't put down the actual science of the technology of the filler and understand why they use the filler in that area. So our goal is to make sure that we teach the practitioners properly so they can evaluate all the different fillers out there, so that they can choose the right filler and explain to the patient why they're choosing that filler. I'm going to use this because I'm going to do it on the periosteum to give you structure. So this is a higher G type of a product. I'm going to do this more superficially because it's a softer, more flexible product that's going to give you more contour and roundness on the face. So concepts like that are very, very important. And so being that we can't off-label, Laura and I formed this company, this education company, to really focus on basic foundation, but then to start teaching about all of these areas to really help practitioners get that experience. And we wanted to create an online digital library, so that will be launching probably middle end of this year, that people can actually join, and we're going to have demonstrations, like videos of us injecting different areas and different parts of the face, as well as didactics that go along with it. So it's going to be a library for a lot of the practitioners that don't have somebody in their office that can help guide them, because a lot of people need the education and they don't know where reference-wise to go to. So hopefully we're going to create a library that they can refer to. Oh, I don't know how to do that. I don't know how to do a slim face. I don't know how to inject Botox into the shoulder muscles. I don't know how to do it in the calf muscles. Like, we're going to have videos on that and talk about it didactically wise. So it's like a reference library for people to just be able to say, hey, I can go to somewhere credible. I can learn about how to do this. Kind of like we do nowadays with YouTube. You don't know how to tiling. You go on YouTube and you watch a video. You're like, perfect, I know how to tile this. And then you try to do it yourself. So for those people that can't afford to come out to our hands-on training, they at least can get some kind of version of a YouTube experience where they can learn properly how to inject and learn the basic anatomy that's involved in that area, learn about all of that stuff. So that's our vision for the aesthetic immersion. We're going to expand beyond just fillers, but hopefully in the future, definitely adding the cleansing center, and then evolving into, more wellness. I'm working with a doctor about IV therapies and potentially jumping into stem cell therapies and all of that. So it's going to be a whole slew of a library, even on the business side, how to run your office, how to create company culture. All of those things that I think are very important in building a proper medical talk, especially just how to help you separate yourself out from everybody else. So it's a love project.
Thank you. People are doing an amazing work, and I wish you all the best. Dr. Gideon, when is your next live? I heard that you're going to do a live with Lori about the
we're gonna do, yeah, so we're gonna do our next live. Me and Lori, it's gonna be 5. It'll be like a 5 or 6 o'clock p.m. You'll have to check our Instagrams. I think July 7th is one that we're going to just talk about fillers and just all of our different experiences with it. So we're going to do a live. So we're going to try and do that once a month and not just talk about us, but we're probably going to start having kind of like you, having featured guests and just chit chat, roundtable, kind of like an Oprah show for aesthetics, hopefully, from the business side of things all the way to whatever we want to talk about, essentially. So that's going to be next Tuesday. And then I think the following Monday, the 13th, I'm doing another one for Mint through our aesthetic immersion. And that one, we're just going to play with all their different threads, and I'm going to just play on 1 or 2 patients and just show what we can do. I think we're going to maybe introduce their newer threads that are coming out on the marketplace in the US at least. So a couple of different things.
You're doing a perfect job of aesthetic immersion. I'm going to also make my post to encourage people to join the webinars. Dr. Gideon, thank you so much for your time. And my apology for this whole technical hint, but we managed to do it at the end.
Yes, we got it. We got it good. Thank you so much.
Thank you so much for your time. I hope you know this whole COVID crisis. You may come to Egypt at the Secret Conference or a course. It will be a great pleasure to have.
Sure.
You're that you came to Egypt before, right?
Uh-huh. I have been to Egypt before.
And you will come again after this cold crisis.
Of course.
Thank you so much, Dr. Gideon, for your time.
Have a good evening. Okay. Bye-bye.